A caregiver recently asked me, what are the effects of care refusals? Whether that care refusal is coming from the caregiver, the person receiving care, or the healthcare system. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, a lot of hope, help, and support for caregivers and aging adults. So the idea of the effect of care refusals. If you search for that, mostly what you're going to see is the idea of care refusals from a medical perspective or a healthcare perspective. But truly, the effect of care refusals is so broad. We're going to talk about the different effects of care refusals from who's doing the care refusal, why this happens, and what you can do if you are in a situation where there's any type of care refusal, care of receiving help, or just feeling a little bit lost. So patients can refuse care. A doctor can make a recommendation and your mom or dad or you or a spouse can say, oh, I don't think that's valid. I'm not going to do it. I'm not going to take a medication. I'm not going to exercise. I'm not going to give up smoking, drinking. Certainly not going to do all these things the doctor is telling me to do. So when you look at the effects of care refusals, this can be frustrating from a physician or a healthcare perspective, as being someone who is trying to help you avoid things in the future that you may or may not know about. So the healthcare system many times tries to help us avoid unintended consequences, but the problem is they really don't do a good job of explaining the decision-making process or what those consequences might be or how they can affect our lives. And so we as the patient really don't understand why on earth we should do this thing that is going to change our habits and our behaviors, and maybe we just don't even see the validity of it. On the other hand, you may want to receive something from the healthcare system, maybe a treatment for cancer or something else that you really believe that you should have. And the healthcare system is saying, we don't think you're a good candidate. Or your health insurance company may be trying to get you to jump through all of these hoops. Many times, unfortunately, because consumers and patients don't know how to interact with the healthcare system, you give up without getting that care or help that you need. So in a sense, the healthcare system has said, no, we don't think you need this. And you don't know how to go about getting what you want, or you give up, or you're just not persistent enough. So why do care refusals happen? Why do people say, no, I'm not going to help you, or I can't help you? Well, a big part of this for everybody, and this is regardless of whether it's healthcare or caregiving or anything, really anything in our life, sometimes we just don't have enough knowledge to convince other people why they should help us, or to even talk about why doing this thing, whatever it is beneficial, why it's good for us, why it's good for somebody else. And if we're in a relationship, so a marriage, or if we're a child caring for an elderly parent or even siblings, there's this relationship tug and pull, give and take, that sometimes we need to look at, why is this good for everybody? Sometimes one person may not see X as a problem, while somebody else may see it as a huge problem. If you're that caregiver, your parents not doing these things, not taking medications, not bathing, not exercising, could be a huge problem for you because you're having to spend a lot more time taking them to doctor appointments and at their house cooking meals and all of this. Your parents may not see the effect on you, and you may not do a very good job at having that conversation with your parents because you don't want to seem unhelpful, or you don't want to feel guilty that you're bringing this up to your parents. But truly, the only way to work these things out is to have honest conversations about how you feel and what's going on. Sometimes we refuse care or refuse to help because we think situations aren't that bad. Other times it could be the behavior of the person who wants the help, and we're saying, oh, you're too negative, you complain all the time. I am not doing this because I don't feel any reward from helping you. You never say thank you. You're never appreciative, and you feel stuck in this caregiving relationship that only makes you feel worse. So let's talk about how we get past these care refusals, or not getting the help that we need, or just making a decision that we're not going to help somebody else. Sometimes, and most times again, it's a lack of knowledge. There could be a lot of options out there that you don't even know about to get help. Or maybe you keep asking the same people and not the right people. There's a whole world out there that we as caregivers and that care receiver may not know about if we're stuck living in our own little world and we don't go outside of that world. Then there's the idea of values. What matters most to you as a caregiver? What matters most to the person who's receiving care? And do you even value the same thing? Do you value the effects of being healthy? Do you value being able to spend time with your family or your grandchildren or your spouse? And do you value those things enough so that you are willing to do things that you may not normally do, like eat healthier and exercise and not drink and not smoke, so that you can have more time with people in your life, so that you can feel better, so that you don't feel as sick? There's trade-offs in everything. And so the idea of the effects of care refusals, it's not only the healthcare system that refuses help, it's caregivers refuse to help themselves. Caregivers refuse to do self-care, to get sleep, to eat, to exercise, because they're so busy doing things for other people, yet those self-care refusals will eventually cause problems for the caregiver. There is a lot more discussion about this topic on my website in a lot of videos here on my YouTube channel and my Facebook page, actually hundreds of videos, and in my online courses. I'm Pamela D Wilson. Check out my website, PamelaDWilson.com. Please share this video. Follow me on my social media channels to receive answers to questions that caregivers ask. Have a fabulous day today. I'll see you all again soon in another video.